I had to prepare something because if you don't, you run over, so you'll have to excuse me if some of this is read and some is spontaneous. When Larry Stanbury told me that I was to be honored tonight, I was, a lot of emotions go through you. I was surprised and humbled, but also gratified and honored. And it's interesting, as I sat here listening to all these nice things being said, I started to wonder, who the heck are they talking about? You don't usually hear such nice things except, well, anyway. I've been told that I should be brief and behave, and I'll try to do both. I would first like to, I'm really going to thank a lot of people. I would first like to thank the program committee that chose me for this honor. I have many others to thank. However, there are many people in the room who I will not be mentioning, not because I don't appreciate you all, but there is just not the time to mention everyone. I've been fortunate to work at a medical center where you always strove for excellence and where you were a teacher and a student for life. The real tributes and honors are your professional and personal life's work, your family, and your friends. You learn about people primarily through their heart and not necessarily their intellect. And your first duty is to your own conscience and honor. My professional life here started after completion of my cardiology fellowship, and I immediately became director of the Pediatric Intensive Care Unit, believe it or not. We grew up much faster then, and it's a very different time. 6 of us started something special in the early 70s that has continued up until today, and I'm proud to say that 4 of us are here tonight. Not only were we colleagues, but I think what made us work so well, we also became good friends, and it's a friendship that has continued up until the present time. As many as you know, pediatric cardiology and pediatric cardiac surgeons are linked together, and you can pick the organ that we're linked at, whatever. I have been very fortunate to have been associated with world-class cardiac surgeons throughout my career, and up to and including the present time, and not everybody who works in pediatric cardiology can say that. As I previously mentioned, I've been fortunate to be an institution that always strove for excellence. That only happens when there is excellence at the leadership positions, which we've had within the Department of Pediatrics and at the university and hospital level. And this has been a consistent occurrence throughout my career. I want to thank all the attending physicians within and outside of cardiology and all of the technicians, administrators, and secretaries that I have worked with. I want to particularly thank all the nurses that I have worked with in my many different leadership roles, for they are the heart and soul of any children's hospital. I also want to thank our parents, patients, and their families who never stop teaching us humility and humanity. I am fortunate to have friends here tonight from all aspects of my life, from early childhood to the present time, including friends from grade school and high school, friends from my home and work, and yes, friends from my reenacting regiment, which is a passion of mine. For the past 25 years, and if you don't know reenactors, you don't know very special people. I have to thank the Lynch family, who have adopted me as an honorary Irishman, not just because of my ability to drink Guinness. And I want to say happy birthday to Cecilia, my sister-in-law, who is celebrating her birthday tonight, but we won't get into numbers. One's family is the most important part of your life, and I have been fortunate to have been given opportunities from my parents to achieve as much as I have. Unfortunately, my mother, because of her age, could not be here tonight. I have also been blessed with wonderful children, 2 of whom are here tonight, and a new addition to our family, Dylan, who is 1 month old today. And I thought of something, and you always think about how you raise your children, and, I'm very fortunate at how they've turned out, but particularly I want to say that you're raising them right because both of them are huge New York Football Giants fans.
Sorry. That's all right.
I would not be standing here today without this special lady. For the past 36 years, we have been partners together in everything. You heard a little bit about her on the video, and I'm not sure I can go home tonight. And I don't know where I would be without her, my special lady, my wife, Carol. My remarks with some special words to our current fellows and our former fellows, many of whom are in the room tonight, particularly because this event has in the past been about the training of the future generations of our specialty. To our fellows, I know in the past that I may have been tough on you. Well, no apologies. I probably wasn't tough enough, and anyway, it was good for you.
It's true.
There has been a lot of talk of how nice and mellow I have become with age. But I just want to remind you there's still a grizzly in here, and I just keep better control of him. And I finally want to leave you with a little philosophy that hopefully you take with you as you go through your careers. First, don't care for your patients with the fear of being wrong. You do a disservice to yourself and your patients. Secondly, it's okay at times not to know, but it's never okay not to care. And finally, most importantly, honor knows no statute of limitations. Thank you all very much for this wonderful evening.
I think you can see what a great talent Alan is, and he will be staying on with us as a teacher, master teacher, and special advisor, so you'll be seeing him in the future as well. Alan, thank you for everything. Before I turn over the podium to Howie, who's going to be doing our live auction,